Hi, this is Dr. Srinagesh, a plastic surgeon from Ojas Aesthetic, Hyderabad, who will be talking on how to zero down and diagnose lipedema, so that there should be very little confusion about identifying lipedema and approaching the right doctor for the right treatment. Lipedema is a disorder characterized by localized deposition of abnormal fat in the lower extremities, especially, mostly in females, extremely rarely in males. And there is a family history of this particular condition. Almost 60% of these people have their female relatives have this particular similar kind of a condition. So most of the people in the family think that it is quite normal and might even pass it off. Now, this particular typical obesity or this deposition of abnormal fat, this adiposity otherwise, is extends from the hips to the ankles, and in the upper limbs it is seen from the shoulder to the wrist. It can be seen, and this particular condition is typically not responsive to regular weight loss or to regular diets. And it is, in addition to this, it is an aesthetic deformity, and most of the people sometimes pass it off as somebody is admired, saying that they have a Brazilian butt or something like that, and but the person is actually having a particular problem and is going to have this particular problem progressing with time. And these people also sometimes have unexplained pains in the areas where there is an abnormal deposition of fat, especially particularly when there is some amount of pressure that is applied on that area, as well as there could be easy bruising in the area. It is a well described disease condition, but is quite often misdiagnosed or rarely diagnosed. Now, how do you identify this particular condition? Now, a proper initial evaluation, a clinical examination is extremely important. The patient usually presents with an enlarged or a swollen lower extremities, that is the limbs, the area from the hips down to the ankle, and a complete history of this particular condition needs to be taken. Now, what you need to know is the onset. You have to focus on the onset of this disease and the duration from when it has occurred, and how the disease has been progressing, how this abnormal fat deposition has been progressing with time, and what kind of periods this particular fat has seen an abnormal growth in spite of any previous attempts to different kinds of treatments. So if any treatment has been taken, we need to have a detailed history of that particular treatment that has been taken, especially if somebody has gone for a massage, what kind of a massage or a drainage, or what kind of treatment has been taken, and what was the response to this particular condition has to be evaluated. Now, you need also to take a detailed family history, because it runs in the families, and whether the grandmother, the mother, some aunts, sisters, other siblings are affected with this particular condition, similar kind of a situation or not. Now, focus should be made more on the extremities, especially the lower extremities, and any differences between the two legs, any previous surgical scars or in the groin has to be assessed. The location and extent of the enlargement of this particular condition has to be carefully noted, because there are different types and different presentations of lipedema. Now, We also need to see whether there is any response to pitting. There is pressure. Once you apply pressure, if there is a depression that is forming, it's called pitting. If there is no depression, it's called non-pitting. And whether you have to see whether there is pitting or there is no pitting. Because if there is pitting, that means there is a lot of fluid collection, and which is responsive to lymphatic massages or compression therapy. And if it is non-pitting, then we have to make an assessment whether there is fibrosis that is set in and the stage of the disease is progressing very rapidly. So, and if it is a long-standing lipedema also, there is the fibrosis might set in and the treatment may become very difficult. And the usual symptoms that are present is, progressive deposition of fat in the hips, thighs, and the legs, or in the upper limbs, with the progressive deposition of fat in the arms and the forearms. The wrist, beyond the wrist, the hand is very nice and smooth and quite thin. Similarly, beyond the ankles, the feet are quite normal, unusually normal for such a large abnormal deposition of fat. As time progresses, of course, even the feet as well as the hands might get affected. And that is a condition where you have to think that the disease, the stage has progressed from lipedema to lipolipedema to lipolymphedema, and then goes to frank lymphedema.